Medical experts have been brainstorming on ways of achieving effective treatment of diabetes, an ailment recording an increase in diagnosis in Nigeria. Jacqueline Ogo has a report on the summit held on Wednesday in Lagos on the subject matter. And here is her report brought to you from our studios.
The pancreas is the organ which releases insulin, which helps the body break down fat and sugar for proper functioning. When the pancreas can no longer release insulin, a person becomes diabetic with manifestations like obesity, foot disease, and more. Doctors say diabetes is fast becoming a health epidemic. Building capacity for the management of the ailment was the focus of this summit in Lagos.
We believe that life is a health journey. And at Sanofi, our philosophy is empowering life. I think what is critical is that people should know that diabetes is a lifelong condition, and it's also critical that they are aware about the causes and what they can do.
Diabetes is often interwoven with other health conditions. For this critical reason, medical experts say it must be handled carefully.
Half of the people with diabetes end up having hypertension too, combined. And both of them are very toxic for the kidney. They can damage the brain. They can both cause heart failure and heart attacks. So any doctor who is treating a diabetic patient must also pay attention to the hypertension and use the kinds of medications that can improve both the diabetes care and the blood pressure control to lock in the protection of the brain from stroke, the protection of the heart from heart attacks and heart failure, and the protection of the kidneys from renal damage.
Some research have shown that environmental pollution precipitates diabetes as toxic particles in the air affect the body metabolism.
So clean air, I think, is a strategy for lowering the diabetes epidemic.
It is not all bad news. Experts say there are effective solutions achievable through proper lifestyle modifications, which means having regular body exercise and abstaining from the types of food and drinks that aggravate the ailment.
And reducing your weight if you're overweight, that can have a powerful effect in reducing the risk, even if you have the genetic risk. By doing the right things in the environment, you can silence the genes.
If the level of blood sugars are not controlled, then with these lifestyle modification measures, then we put the patient on tablets. And depending on the level of control we have, a stage comes where we need to introduce insulin. And we usually tell patients that the end justifies the means in treating diabetes. So if a time comes and we need to give insulin injections, they should not object.
The effective treatment of diabetes is ruled by strict adherence to doctors' advice. These medical doctors and pharmacists hope to come out with new strategies for tackling the ravaging ailment at the end of their deliberations.